How does seronegative RA cause joint erosion? Have you ever wondered how seronegative rheumatoid arthritis can lead to joint erosion? Even without the typical autoantibodies, this condition can still cause significant damage. Let's break it down. Rheumatoid arthritis is an autoimmune disease that primarily affects the joints. It leads to inflammation in the synovial lining, which is the tissue that surrounds your joints. In seronegative rheumatoid arthritis, patients do not have detectable levels of rheumatoid factor or anticyclic citrullinated peptide antibodies. However, that does not mean the disease is any less serious. In fact, the absence of these autoantibodies does not prevent inflammation from occurring. The inflammation results in immune cells, like lymphocytes and macrophages, infiltrating the joint area. These immune cells releases inflammatory substances called cytokines and enzymes. These substances are responsible for breaking down cartilage and bone, which leads to joint erosion. When we look at the synovial tissue in seronegative rheumatoid arthritis, we see changes like thickening and an increase in blood vessels. This thickening is known as hyperplasia, and it indicates that the synovial lining is becoming more active. The presence of immune cells contributes to ongoing inflammation, which is crucial in the erosion process. Interestingly, research shows that seronegative rheumatoid arthritis generally has milder inflammation and less severe bone erosion compared to seropositive rheumatoid arthritis. However, this does not mean that joint damage cannot occur. In some cases, if the inflammation is not effectively managed, erosion can still develop. Diagnosing seronegative rheumatoid arthritis can be more challenging since it lacks the typical markers found in blood tests. Therefore, doctors often relying on clinical signs and imaging to assess disease activity. It is essential for patients with this condition to be monitored closely for joint damage. Treatment options, such as disease-modifying antirheumatic drugs, can help reduce inflammation and prevent further erosion. In summary, seronegative rheumatoid arthritis causes joint erosion through persistent inflammation and immune-mediated destruction of tissues, even without the presence of autoantibodies. While the extent of erosion may be milder, it remains significant, highlighting the need for early diagnosis and appropriate treatment. Always remember to consult with healthcare professionals for personalized advice and treatment options.